How can I help you?
Hi, I was calling today to ask some questions about getting on birth control.
Okay. So you'll need to make an appointment,
Yes.
and so I can send you to the front desk, and they can make you an appointment.
Well, I just wanted to ask, what is required for me to get on it with you guys?
Well, have you gone to another public health office, or?
No, this would be my first time going to one.
Okay, so it's on a sliding fee scale,
Okay.
so we don't turn anybody away.
And pause. They may not be turning anyone away in the way this woman thinks I'm talking about, but they're definitely turning people away. Okay. And
Okay.
what exams and stuff like that do I need to do?
Well, first of all, they'll do screening for gonorrhea and chlamydia, and give you birth control.
And pause again. They probably should have told me there would likely be a pregnancy test as well, just so I would be aware of that and could prepare for it.
Then later on, you'll be made an appointment to get an annual exam.
And pause again. The wording in itself here is a massive red flag. Saying that I'll be made an appointment to come get an annual exam implies that I don't have any say in the matter or choice in the matter whatsoever, and that's disgusting. Do I have to get an annual exam?
Not at this time.
But in the future I would?
Yes.
And pause, because wrong. You do not ever need an annual exam such as a pap smear or a pelvic exam to safely and effectively use a hormonal contraceptive method like the pill, which is what I'm calling today inquiring about. This person just outright violated my right to informed consent with her whole chest. Like a pelvic exam and a pap smear and stuff?
Yes.
Why is that?
How old are you?
I am 26.
Oh, 26. Because that's a requirement after a certain age that you have a.
And pause. It is never, ever, under any circumstances, regardless of age, a requirement to have an optional screening exam, which is what a pap smear or a pelvic exam is. It is an optional screening exam. Things that are optional cannot be required. That is not a requirement. That is a violation of informed consent, ma'am.
Well, let me see. Hold on, let me ask the nurse.
Okay. And pause once again. Right here, I want you to notice how quickly this woman gets off the phone and gets a nurse on the phone when she realizes that I know words like informed consent. Yeah, I'm still here.
Okay, this is Amanda, one of the nurse practitioners. So, it's recommended that once you turn 21, you do a pap test to screen for cervical cancer. So it's just a screening.
And pause. She says it's just a screening, yet she fails to tell me anything about the screening, how it's done, or why it is done. I understand that, but I'm a little confused about why that is a requirement.
It's not a requirement, you can refuse, it's just recommended.
And pause. Obviously, this is a completely different answer than the one the clinic coordinator I just talked to gave me. The world may never know if that was genuine confusion on the part of the clinic coordinator or if this is just gaslighting. Okay, but will my birth control get taken away if I don't do it?
No, but if, look, what you're saying, if you're coming here, you might as well.
And pause. If you're coming here, you might as well do it. No, that's not a good reason to recommend any screening exam to anybody. Where's the facts? Where's the science? Where's the explanation of what screening is and why I should consider having it? Absolutely nowhere. That's where.
Let's just ask, why don't you want to do it?
And pause. This in itself might not necessarily be a red flag, but I do want to point out that directly asking a patient who is hesitant to do an exam like a pap smear why they are hesitant to do that can kind of make people in situations like being a survivor of SA feel very cornered and pressured into telling the person something they don't want to tell them. I used to feel really pressured by this question to disclose my status as a survivor, and I usually was not comfortable with disclosing that. Language is really important in situations like this, and this language can make patients feel pressured to share something they're not comfortable sharing.
I can go from there.
It's a pretty personal reason that I'm not sure I'm comfortable discussing.
Oh, okay. All right. We're gonna do your birth control. It's not gonna take it. We're not gonna take it away from you.
Okay, so it isn't a requirement.
It's not a requirement. It's just a recommendation. Because we're just because per CDC and we want you to start doing your PAP at 21, so we can screen you for cervical cancer. So if there's any change in your cells in your cervix, we can catch it on time.
Yeah, I understand. Can I just ask why you tell people that's a requirement if it isn't one?
And who said that?
You did.
No, I just got on the phone now. I didn't say that. I said it was a recommendation.
Okay, well then the previous person I just talked to said it was a requirement.
That's why she's not really sure. That's why she called me to come talk to you.
Either this is gaslighting or this clinic is woefully misinformed on their own policies and what one person is telling other people. It very well could be a too many cooks in the kitchen sort of situation. But regardless of their intentions, the clinic coordinator needs to be informed this is not a requirement, because she is violating people's rights to informed consent by going around telling everyone they're going to be forced to have a pap smear and a pelvic exam if they come to this health department for birth control. And she is ultimately discouraging women and AFAB people from accessing safe and effective contraceptives. Okay, well, if you might want to mention to your guys' staff that that's not a requirement, and telling people that kind of is a deterrent from them coming to you if it's a situation like mine where it's a very personal reason.
Yeah, I don't think we have never ever refused anybody. People refuse PAP all the time.
Even if this is the case and no one has ever actually been refused service for refusing their annual exam, it's still really detrimental that the clinic coordinator is telling people this.
Refuse PAP all the time. I had one yesterday that said she doesn't want to do it, and that didn't stop us from doing her family planning.
Okay. So, in this one conversation, two separate members of the clinic staff told me two completely conflicting stories about what was asked of me to get on birth control. And if I was seriously calling today seeking contraceptives, and this wasn't just a little social experiment, then I would be very much discouraged from getting on that birth control. Which, of course, puts me at risk for unsafe sex and unwanted pregnancy. The past version of me also would have felt very pressured to disclose my status as a survivor when I didn't feel comfortable doing so, which of course can be very detrimental to someone's mental health. Overall, I'm seeing a lot of red flags here, and I do not recommend this clinic.